Hi and welcome back. Today I'm bringing you along for my very first Sculptra session and I am quite excited. However, my appointment is in 10 minutes, so I have to run. I will tell you more about what Sculptra is, what it does, and why I decided to do it as we go along. So let's go. So this is my beautiful provider, Dr. Guzman. Hi, Dr. Guzman.
Hello, everybody.
Dr. Guzman, can you tell us what Sculptra is and what it does?
So Sculptra is a product that we call a collagen stimulator. And the objective of the treatment is, as the name said, is to stimulate the production of collagen that you naturally got in your body. And the particularity of this product is that you need to wait and see. So that means that once we do the injection, so the product is going to integrate to the tissues, then you are going to have a phase that is going to slow down, and that is a week. And that second week, you are not going to have like a nothing. And then from the third and the fourth week, that begins to build up and to stimulate the collagen. That is the thing that we want to treat. You put the product, and then you got volume first week, then that fade out, so you begin like nothing has been done. And then once the tissue is going to be stimulated by the product, the fibroblast is going to produce collagen in order to give the volume, and that is going to be in 3 to 4 weeks. So it's a slow down treatment that you need a protocol, because only one session is not going to give you the results that you are hoping in the very, very beginning, because in the first week you see that the product, and because of the liquid, so that is going to get a little plump up, but then that is going to fade out. So that is the inconvenient, but then that is going to begin this process of stimulation that is going to be from the third to the fourth week. And then we can organize a second session, and that is going to improve and to enhance the result of the first session. And then generally we need a third one. So in between sessions, we need in between 4 to 6 weeks. And generally it's a protocol of minimum 3 treatments.
Mm-hmm. So the first week you look nice because you have that little bit of liquid in.
Exactly.
And then that disappears. And then over the next 6 weeks, your body starts building collagen.
Exactly.
Can you show us the product?
So the product comes like a powder, like this. And then we need to prepare. So we already prepared for Claudia. So that is sometimes it's 24 hours before. There are other protocols that say 2 hours before, but I prefer 24 hours before. And one is mixed, so they will look clear and ready to get injected. And that is, Sculptra is one of the brands, because anyway, the product calls poly-L-lactic acid, which is a product that we naturally use in the suture, that we use in body, so it's quite natural. It's going to reabsorb and stimulate. And the interesting thing, because obviously that is going to last longer. So once we achieved of the volume that we desire, so that is going to last up to 2 years. So it's quite interesting in long-lasting results.
But it is your own body producing it. It's not like filler. It's your own body.
No, it's your own body which is doing the job, which is going to be stimulated by this product in order to produce your own collagen.
That's beautiful. Are there any contraindications?
Yes. So the principal contraindication is, well, obviously infection in the area, but things that are regular for any procedure, but particularly with the fillers in general, is when you got an inflammatory diseases.
So autoimmune disease.
Exactly. So like a lupus, for example, arthritis. So we take care of these kind of patients that we don't want just stimulate the immune system. So maybe to have problems. So these are the principal contraindication.
So somebody with an active autoimmune.
Exactly. Active autoimmune disease is not a good candidate for a Sculptra or to a collagen stimulator products. Okay.
Great. Let's do it.
Let's do it.
As I'm editing this video, I realize I have to give you a little warning. Now, this isn't gory, there is no blood or anything, but if you do not like the look of needles or cannulas, then please do not look any further. I will leave timestamps in the description box, and you can just jump ahead to after the treatment. So let's get back to Dr. Guzman. So unfortunately, a radio was playing in the background. I didn't even notice. I was way too nervous. But YouTube is quite strict about copyrighted music. So unfortunately, I do have to do a voiceover. Dr. Guzman did say some very important things, but I will do my very best to repeat them. So after cleaning my face, Dr. Guzman marked where she's going to inject the Sculptra. For that, she had me smile to create some dynamic wrinkles. Now, as you can see, she is mostly marking the lower part of my cheeks. However, she did suggest next time to also inject a tiny bit of Sculptra into my temples. So once more, Dr. Guzman has me smile to create some dynamic wrinkles to really make sure she knows where she's going to inject the Sculptra. And here she's handing me a mirror, showing me what she's going to do and making sure I'm okay with it. Now, in my initial consultation with Dr. Guzman, she told me I was the perfect candidate for Sculptra because my lower cheeks are quite sunken in. Interestingly, Sculptra was FDA approved in 2004 for the correction and/or restoration of facial fat loss in HIV patients. So it is the perfect treatment for somebody like myself who has rather sunken in cheeks, and that is what Dr. Guzman is talking about here. She is saying that if somebody already has quite chubby cheeks, this is not a good treatment. So right here, Dr. Guzman is giving me some local anesthesia, which is really the only part of the treatment I felt. I felt her inject my cheek, and once the local anesthesia kicked in, I didn't feel a thing anymore. But she did inject 4 different spots on my face with local anesthesia, for which she had me smile one more time to, again, create some dynamic wrinkles to make sure she is injecting in the right spot. After injecting me with the local anesthesia, we waited for about 10 minutes. And right here you see Dr. Guzman clean off my skin one more time. And she's doing a little test here to see if the local anesthesia indeed kicked in. And as you can see, I am not feeling a thing. She also, with this test, created a little opening for the cannula to pass through. So right here she is showing us the cannula she's using, and what she's saying here is that rather than a needle, which is sharp, a cannula is rounded, which makes it much less aggressive when inserting it into the skin. In fact, it really hardly causes any damage nor discomfort. And you can see here Dr. Guzman is fanning the Sculptra out under my skin. And while this looks a bit brutal, I did not feel a thing. It was quite interesting because as I was filming it, I could see what Dr. Guzman is doing. And like I said, it looks a bit brutal, but I really did not feel a thing. Now, of course, that is partially due to the local anesthesia. In fact, Dr. Guzman was joking around that is the beauty of local anesthesia. Also, the Sculptra itself has a bit of anesthesia in it. And then, as Dr. Guzman said, the cannula being round is causing much less trauma than, let's say, using a needle. So you can see Dr. Guzman is doing a beautiful job fanning out the Sculptra. Here she has me smile one more time, which at this point is getting a bit hard because the right side of my face is pretty numb. And now she is coming in from a different angle. So once more, she is creating a little opening, which is also a test to see if I have any feeling there. And no, I didn't feel a thing. So once more, she is injecting the cannula, this time, as I said, from a different angle, and is doing a beautiful job fanning out the Sculptra. And again, I saw in the camera what it is that Dr. Guzman is doing. And again, I admit it looks a bit brutal, but I didn't feel anything, not even discomfort. So here I'm actually telling Dr. Guzman that this is so interesting because I did not feel a thing and I was basically nervous for nothing. So now we're going to the other side. And Dr. Guzman is saying that the little white spots I have are from the local anesthesia. Now you see that I have a bit of a blue spot under my cheekbones. That is not a bruise. It is something I always have because I have quite thin skin. So just as on the other side, Dr. Guzman is doing a little test to make sure I am sufficiently numb. And with that test, she also created an opening for the cannula to pass through my skin. So same thing as on the other side. Dr. Guzman is doing a beautiful job fanning out the Sculptra. And once more, I am not feeling a thing. Now, I did ask Dr. Guzman if there is going to be any pain or discomfort after the treatment once the anesthesia wears off. And she mentioned that with the treatment, as well as after, of course, everybody's pain tolerance is going to differ. For me, as I mentioned, I had absolutely no pain, no discomfort during the treatment, which is interesting to me now, watching it back. It does look, I have to admit, a bit brutal, but I really had zero discomfort. I did not even feel what it was she was doing. And spoiler alert, even after the treatment, I had no discomfort. So while both of my cheeks are quite sunken in, my left side is sunken in even further than the right. So Dr. Guzman mentioned that she put just a tiny bit more into the left side than the right. And once more she had me smile to see if we had good results. And it's getting tougher and tougher to smile because at this point my whole face is numb. And just as on the other side, Dr. Guzman is coming in from a different angle once more and fanning the Sculptra out from this different angle. Once done with my lower cheeks, Dr. Guzman had just a tiny bit of Sculptra left, so she injected about a drop each into my upper cheeks. However, it was difficult to film. And then after the treatment, Dr. Guzman stressed massage is critical. It helps the product integrate into the skin and helps prevent granulomas. So you want to massage your treated area in this manner 5 consecutive days, 5 times a day for 5 minutes each. So it has been about 5 hours or so since I had my first Sculptra treatment, and I'm actually amazed I don't have any soreness or anything. There is a tiny bit of bruising, which was to be expected, but no soreness or anything. And you saw me during the treatment, there really was no discomfort at all. My face was numb for quite a while afterwards. It's kind of like when you go to the dentist and your mouth is numb for a while, but now it's all gone. And like I said, there's no discomfort. But as you can see, there's a tiny bit more volume where I am normally quite sunken in. And that is, as Dr. Guzman said, because the Sculptra, the PLLA, is constituted with a liquid. So that liquid is going to be absorbed by the body within the next few days. Then I will look completely normal again, and then my body will start producing a bit more collagen. So I will check in with you again, probably tomorrow, unless there really is no change, then within the next couple of days. Let you see what it looks like, tell you how I feel, and I'll also let you know why I decided to do this. So I'll see you soon. So it actually has been 10 days since I had my very first Sculptra treatment. I wanted to wait a little bit to get back to you so all the fluid could dissipate. But as I mentioned in my follow-up video right after the treatment, there has been no pain, no bruising, no discomfort. I am amazed. I did do my 5 days of massaging 5 times a day. I'm not sure I actually did 5 minutes 5 times a day, but I did my massaging, and even with that, there was zero discomfort. So let me come a bit closer. As you can see, the little bit of extra volume I initially had in the lower part of my cheeks is gone. They are sunken in again. However, it's a bit hard to see on camera because I do have lights shining at me. Without them, I would be sitting in the dark. But I will put a picture right here, which I took this morning, so you get a better idea of what my cheeks look like without the lights shining at them. But as Dr. Guzman said, this is a wait and see treatment. Because the PLLA is mixed with fluid, so it can be injected, there will be initial volume. However, the body is going to absorb this fluid in a week or so, but then the PLLA is going to stimulate fibroblasts, which in turn stimulates collagen and elastin production. So hopefully within the next 4 to 6 weeks, I will be building a bit extra collagen and elastin right here. Now, while I always want to be completely honest with you and share with you what it is that I am doing, I also at times struggle a bit sharing these sort of things with you. I even struggled sharing the radiofrequency microneedling or microneedling in general. In fact, I talked about that in my very first microneedling video. Because while I'm a bit of a scientist at heart, I have always loved doing something to help the body do what it naturally does, but is getting a bit sluggish at, in this case, collagen and elastin production. So while I have always enjoyed doing these sort of things, I'm also a big believer in learning to love and accept ourselves. And at times it seems as if the two just don't match, as if doing something to improve our outside appearance while learning to love and accept ourselves don't match. For me, this journey of learning to love and accept myself has been a long one I'm still on, one that is very important to me and I don't ever want to compromise. However, on the other hand, I also want to be pretty. We all want to be pretty, and I want to look the best I can. So personally, I do believe the two can match, but of course, we also know there are much more important things we can do to feel good about ourselves than to improve our outside appearance. And the reason I'm saying all this is that I don't ever want you to think you have to do any of these things. Aging gracefully means something different to all of us, and we have to decide what that means for us. Like I said, for me, these sort of things are fun, and now that I have this channel, I find myself wanting to do these things more so I can share them with you. But again, please know you don't ever have to do any of these things. There are way more important things we can do to feel good about ourselves. Now, for me personally, why I wanted to try Sculptra is, as I said, this journey to love and accept myself has been a long one for me. And there were decades when I looked in the mirror and did not like what I saw. When I look in the mirror now, I love what I see. I see my flaws, internally as well as externally, but I have learned to love and accept myself regardless. However, when I look in the mirror, I also see that my cheeks are quite sunken in. I actually really love my cheekbones, but like I said, my cheeks are quite sunken in. Now, it doesn't bother me that much, but when I lose just a couple of pounds, for example, on vacation, we were really active, we hiked all over the place, and we just didn't eat enough. And I lost a few pounds, I'm not sure how many because I don't weigh myself. And we lived in a camper, so there wasn't a mirror. But when I finally looked in a mirror, I thought, wow, I really look a bit sick. So if I just lose a few pounds, I start looking sick. And I thought, if there's something I can do to improve that look, why not? Now, I did try filler for my wedding. So about 10 years ago, I had a bit of filler here. I loved the way it looked, but it went away rather quickly. And I like this much more. It appeals to me much more because it's the body doing its own thing. So that is why I wanted to do Sculptra. And I already have another session scheduled in 5 weeks. So again, as Dr. Guzman said, this is a wait and see treatment. So you get a treatment, you wait and see what your body does. You most likely need another session. After that, again, you wait and see, and then you might need another session. So I have a session scheduled in 5 weeks already. Of course, I will keep you posted, and hopefully we will see a bit of difference. And then, as Dr. Guzman said, the results last for 2 years, up to 2 years. I do believe you want to do a 1-a-year maintenance session, but we will cross that bridge when we get there. So I know somebody's going to ask me about the cost. I live in Paris, which is one of the most expensive cities in the world. Here in Paris, Sculptra is 600 euros per session. 600 euros is about $550. And that is a lot of money, but depending on where you live, the price might be completely different. So I think that's all I can tell you about Sculptra right now. Any questions or comments, please leave them down below. You know, I always love to hear from you. And I would love to know, have you had this treatment? And if so, how did you like it? What sort of results did you see? How many sessions did you need? What did you pay? Anything you want to tell us about Sculptra, please leave it down below. I would love to know, and I'm sure many of you would as well. So thank you so much for being here. Until next time, bye.